Welcome to the How To and Two podcast. I'm your host, Jesse, and we have Claire with us as well. And Claire, we're super excited to have today's guest on. Something that I actually struggle with slightly. I love basketball, and I have the worst joint pain after basketball in my knees every single morning after we play. In fact, you've seen it as I come hobbling to work sometimes. So we're super excited to learn more about this subject. It's a form of arthritis. It's osteoarthritis, which I believe is in the joints. But we're talking today with Alyssa Kuhn, and she's a coach, and she helps people overcome the symptoms and also better people's lives. In fact, her whole slogan is "Keep the Adventure Alive." So, Alyssa, welcome. Thank you so much for being on our show today, and we're super excited to have you on. Like I said, me personally, I have a little form of arthritis in both my knees and my knuckles, and I freaking hate it. But it's hereditary from what I understand.
Genetics do play a part.
And that's what my doctor says. So
Yes.
it doesn't help that I'm probably about 20 pounds heavier than I should be too, but that's another story for another day. But awesome. Well, Alyssa, go ahead and kind of give us your background. Why this particular form of arthritis, and why are you doing this? Let's just learn about you.
Yeah, absolutely. So I'm a doctor of physical therapy, and I worked in home care for a while, helping patients right after total knee and hip replacements.
Okay.
And so many times that happens when osteoarthritis is so severe that they can't walk, that it's limiting their lives, that they really can't do anything because of pain. So a lot of times when people get this diagnosis, there's lots of misinformation around what it actually is, how it happens, and how it can be managed. And so a lot of people think it's from wear and tear, and then they get this diagnosis that, oh, your joint is deteriorating. They get an x-ray and it's like, oh, degenerative, all of these sorts of adjectives. I mean, when you hear that, it's like, oh my gosh, I need to stop doing everything. I'm going to just damage my joint. And so a lot of times people give up exercise. And that's kind of the first thing that goes, because I want to preserve my knees, I want to preserve my hips, and we start living on the couch.
Yeah.
When in reality, the cartilage and things, it's a biological process. It doesn't really have anything to do with wear and tear per se. No matter what you do, especially for you, like if it's in your genetics, it's likely going to happen, regardless. Mm-hmm. It's a biological process that gets started. And so a lot of people, like I said, just give up exercise, give up all of these things, and in reality are just making it worse by doing that. You're just collecting all of this inflammation.
That's interesting, because I have found the pain I feel the most is when I wake up.
Yes.
That's the first time, but it's like, well, if I laid there, I'd still be in pain all day. So I usually just get up and go hit the bike or do a treadmill type of thing. And then I almost kind of describe it as like it goes away and you don't feel it anymore, because it's like almost like revving up an engine, right? Like just letting it sit out there and idle and get warm for a minute. So that's how I've always just kind of embraced it. Is like, yeah, this sucks, it hurts, but like you got to get up and do that. So that's interesting, because I can see where people would sit there and be like, you know what, I don't know if I want to sit on the couch or I don't want to go out and do that today.
Well, it's crazy, because even like, I mean, I don't feel like I'm old. I'm 34, so I'm not I don't feel like I'm getting up there. But like even now, like I just think in general, if I go out and work out and I'm sore for a very long time, I'm like, I don't want to do this anymore.
Yeah.
And so I can see how people, if they're having pain, they're like, I don't want to feel like this, so I'm just gonna stay here.
Right, but so with osteoarthritis, I usually explain it. So I mean, you have inflammatory cells and anti-inflammatory cells. For us, when we don't have pain, our anti-inflammatory cells are efficient. They're able to get all of the inflammation out, so we don't have pain. As we get older, that efficiency goes down a little bit. And then with osteoarthritis, you're getting more inflammation and you're losing some of those anti-inflammatory cells. So now you have more inflammation, which is why, like in the morning, or when you're sedentary for a long period of time, so sleeping, sitting for a long period of time, those inflammation cells collect. And in order to start getting some of those anti-inflammatory cells, you have to move. Any sort of movement. There's tons of research that exercise helps build those anti-inflammatory cells. And so the longer you sit and the longer you're in one position, or the longer you don't do exercise, the more inflammatory cells you're collecting. And then that just continues to kind of act on the cartilage, and really kind of, that's when the breakdown starts to happen. So
interesting. And on every episode, I tend to go down like some rabbit holes, because as we learn more, I'm just like, whoa, questions, right?
Yeah.
So, I mean, obviously you have your inflammatory cells, right? But how much does food take into that as well?
A lot. So, I mean, it's honestly probably 50-50, I would probably say, because exercise alone isn't going to do anything. I always tell people, if you're starting an exercise program, you're essentially digging a hole to, reach your goal.
Right.
But then if you go and turn around and eat a bunch of processed foods or a lot of sugary things, you're just filling that hole right back up. And so you're never really making progress. You're just kind of staying stagnant in that pain relief. And so you're never really seeing any results. But if you can continue to have exercise and nutrition work together, then you can get closer to your goals and have it be quicker as well.
Interesting. Like I said, it just continues to open other questions. And that's the whole purpose of this, because I mean, this is something that we love to do, is just bring awareness of certain topics and things that people may not know or that they're researching. From what I understand with arthritis, that you don't really notice it and it just kind of comes up, and then one day you're like, oh my gosh, and it hits you hard, and then before you know it, you're like, what's wrong with me?
Right.
And that's essentially when people start going to the doctor and then getting nervous. I thought for sure I had pulled like an ACL or MCL in one of my knees because it was just too much, and then went there and found out that it's arthritis, and that's the way it is. And
but did that change your thinking a little bit when you were told that it was arthritis?
Not necessarily. Because for me it was like, oh, I love basketball too much to quit, so I'm just going to grind these knees out and regret it later.
So is it something that's like reversible then, or is it something?
It's not necessarily reversible. It's kind of a chemical process, so you are still going to have just a slight discomfort, but it's the fact of preventing it from getting worse and getting it so severe that you have to get surgery. There's not necessarily a cure for it, but you just essentially manage the symptoms so it doesn't bother you as much, and you can still live your life and do the things that you want to.
Got it. So the folks that are getting either hip replacement or knee replacement, they've kind of gotten to the point where it's like it's unmanageable at that point.
Yeah, and I always tell people when they're thinking about a joint replacement or thinking about a surgery or anything like that, if it's to the point where, you have tried exercise, you have tried diet modification, but you just can't live without pain. I mean, you just have so much pain you can't walk, you can't, do anything, which is why we have to start catching this early.
Right.
Because if it gets to be that severe, then it's hard to manage it conservatively, to get back full function.
Interesting.
So that leads me to another question of my little rabbit hole craziness here. But when you have a hip replacement, you mentioned that earlier, does that increase the likelihood of getting arthritis? I could only imagine so.
Not necessarily, because what they do is they essentially take out the bone and then put in an artificial bone.
Right.
So there is some success with joint replacements. I've kind of seen both ends of the spectrum. And it doesn't necessarily correlate with increased arthritis. Sometimes if you have arthritis in one joint, you're more likely to get it in another joint, especially if it's not managed. But the joint replacement essentially, helps with pain, helps with all of those things, helps get function back. But there are some limitations, especially for the hip. You have a risk of a dislocation. There's always a risk for infection. I've seen more infections in a knee replacement than a hip replacement.
Interesting.
Sometimes they have to go in and do another one or do a revision or things like that. So, I mean, there's always a possibility of a revision or having to do something, a complication. So that's kind of why people tend to not go down that road for pain relief and things like that. But the joint replacement doesn't necessarily correlate to increased arthritis.
Interesting. I mean, like I said, it's one of those things you just continue to learn more every
Yeah.
single day. Like,
But
you don't know.
if it doesn't heal right, so
Yeah.
if you don't do therapy or you don't do anything and you got a hip replacement, then it could move into your knee because you're not moving correctly. You don't have that range of motion. If you don't have the range of motion or movement in one joint, you have to get it from somewhere else. And so you kind of pull from other back pain, that sort of thing.
Interesting. So don't quote me on this, but I know there was a doctor down in Payson, and I'm drawing a blank with her name, but she was very into the ankle and like the ankle bones and things like that, because
Okay.
she said that a lot of times that your pain and other things come because you tweak an ankle, and then it continues to go up the leg and into the back because you're correcting yourself, and things start to change. And then with that change, your cartilages and things like that start to deteriorate because there's a different rubbing sensation going
Different
on,
wear and tear.
in the cartilages. And so it's just interesting to think about that. Can you elaborate a little bit more on that
Yeah.
as well? Is that true? I mean, I've heard it, but who
Yes.
knows?
So that's a thing that's very, very common. Like if somebody has knee pain, and so when you have knee pain, it might not necessarily be something structurally wrong with your knee per se. It could be hip weakness. It could be something in your foot, whether you have sprained your ankle lots of times and especially playing basketball. and
Yes.
things like that. Rolled your ankle and never really had any rehab or anything for it. Then that can play a part, because then, single leg balance plays a part. Everything, your like core muscles, your core stability plays a part. So it's all connected. So whenever somebody comes in for, say, knee pain, we look at the hip, we look at the ankle, we look at, low back and core stability, all of those things. And it could be even side to side differences, some asymmetries,
Wow.
that sort of stuff.
Wow. So now you know how the professional athletes don't have that problem right? Until they're older.
Yes, yes.
Wow, that's incredible.
Yeah.
So, what do you love about what you do? Because you are a personal trainer as well as doctor. Like, what kind of, like, what's your background, your title that you would say, or how you would describe yourself?
Yeah, so it's a doctor of physical therapy, and then I'm also a CrossFit Level 1 certified trainer.
Okay.
So kind of meshing both of those together. What I have found so far with my clients is my biggest passion is to empower people that, one, age doesn't have to dictate function. How many times have we seriously heard that, as we get older, granted, I'm not older, so I'm not 50, 60, but you just hear this all the time, that people are like, oh, my knee hurts, but I'm just getting old. That's just what happens. And that doesn't have to be the case, because then you go hiking and you see someone who's 60 or 70 just out going up the hill, no problem. Right. And so pain isn't something that you have to deal with. It's not something that just comes with age. And so I want to empower people that doesn't have to be the case. You don't just have to succumb to, oh, I'm just going to have pain and I just can't do that anymore. Now, there are certain circumstances, like, say, running a marathon or something like that. But there's people that are 70 that have ran marathons. So, the possibilities are limitless. And granted, there are a few things that are out of our control. Neurodegenerative diseases and Parkinson's and all of those kinds of things. But, working with what we have, I want to create these possibilities for people. And so I've had a couple of clients now. I have one who was mountain biking 6 days a week. She's 59, and she's having some knee osteoarthritis. Mm-hmm. And so she doesn't feel as confident on her mountain bike and has actually stopped hiking because of it. And so we're working to get back to that. And so it's just giving people their life back. Like, keep the adventure alive. Adventure doesn't have to be jumping out of a plane. It doesn't have to be summiting like Mount Everest. It is just anything that keeps you happy, that keeps you excited. I always say that you want to maintain the ability to do what keeps you happy on the inside. So it doesn't have to, everyone's adventure is different. So it doesn't have to be anything elaborate. It's just...
I love your slogan, to keep the adventure alive. Yeah. It's perfect.
I love adventure. I don't know what it is. It just never gets old.
Word.
Yes, I love it. It's not cheesy or anything. It's perfect. Like adventure. Yeah. Like when I think of we have a little 6-year-old. That's what I always say. She's just always up for adventure. She just is. But like, I'm curious. Obviously, a more age-defined scenario, mm-hmm. right? And you could. You're like you mentioned. You're level 1 CrossFit. So I would guess you work with folks that are around your same age.
Yes.
So what drove you to tackle working with folks that have a little more life to them?
Yes. So I actually did one of my clinicals in PT school was at an independent living facility, and kind of combining CrossFit principles and the way the workouts are structured and things like that. And then also doing a group fitness class with older people. I mean, these people were probably 70 to, I think the oldest was like 96. And it was just so cool because when you go into like an independent living facility, you expect to see like balloon volleyball and people sitting in chairs and doing like chair yoga and things like that.
Sure.
But within like when you have higher level clients, I mean, they can do like I had some relay races and things set up, obviously before coronavirus. But and I mean, we had clients that were running, like people were just so competitive, and it was so cool and it was just like, I mean, this lady was, I think she was 96, and she was just having a ball, no cane, no walker, just she swam every morning and then would come to class, and I mean, it was just. I just loved it. It's just so rewarding to, give people life back and kind of make their later years the best ones. Because a lot of people think your later years aren't, not anything to look forward to. When in reality, I mean, it was a social hour, it was all sorts of things. And so then I just kind of started to push, age doesn't have to define function. Just because someone is older doesn't mean they need pink 1-pound dumbbells. I mean, it's just all of these stereotypes. So being able to kind of push through those was cool. We were doing burpees, we were doing all sorts of stuff. And so
nobody likes burpees.
Yeah.
Yeah. 2 burpees in and I'm throwing up.
Yeah.
That's how it goes. Alyssa, I really love what you're doing with the older generation too, because I feel like I had a grandma that lived to be 87 years old, and before she passed, I mean, she was walking and moving and doing that kind of stuff. But I think about her because, her grandkids are all grown up, they all move out, and then she lost her husband and she's by herself. And I think that, she did her best to stay integrated in the community, but you can only do so much.
Right.
And I love the fact that you're putting together events and things to help include the senior citizens, because I think that that's something that a lot of people don't do, not
Right.
because they don't want to, it's just they don't think about it.
Right.
And I feel like some of these senior citizens get neglected sometimes. And so I love that you're doing that and putting together those events, because it does get lonely sitting at home,
Yes,
and then if you're
absolutely.
in pain, if you do have this arthritis, then you don't feel motivated. And unfortunately, if you're not moving and you're not acting and doing stuff every single day, eventually your life gets cut
See
shorter.
decline, right.
Yeah.
Right.
So I love it.
Yeah.
So I would love to hear an influential story or a client you work with that gets you back to work every single day. Because we all know in entrepreneurship, you go up and you go down.
Right.
And it's a roller coaster ride. You get that nice, awesome opportunity, and then 2 minutes later, never mind, we've went with someone else, right? So what is that influential story or that one pivotal moment in your life that you wake up and if you need to, you go back to it?
Yeah. So I had one client who was, I think she was 84, and she had Huntington's disease, which is a neurodegenerative. You just kind of have spontaneous movements, and your movements start to become harder to coordinate and control. And she had some arthritis and things too, and she lived out in the country, had about 20 stairs to get up into her house, just to get to the front door to the main level. And she was the sweetest lady, and she just did not have the cards that, the best cards that she was dealt. But she kept such a good mindset, and she was so motivated. Anything I told her, she was up for. If I would have told her to try to stand on her head, she probably would have. And so,
Awesome.
I mean, she was just amazing. And so she had a couple of falls and was having a hard time getting back up, had to depend on her husband to kind of lift her up. And so we got her to the point where she could successfully stand up from the floor without using her husband or anything. So we built up that strength, and then she was able to go up and down the stairs with no problems, even just 1 foot after the other, because a lot of times you go up one at a time. 1 foot after the other, no problem. And so she was the sweetest woman, and it's just, so rewarding. I mean, even just simple things like climbing up the stairs or getting up from the floor, I think is awesome. And then seeing it firsthand, like seeing her in her home with her husband, you know, kind of being able to do these things was very rewarding. And for me, that's more rewarding, you know, than working with athletes and things like that. And so just getting function back and then working towards then, you know, fitness and that sort of stuff.
All right, and now push real strong through your front leg. Perfect.
I think for any coach, seeing the confidence that your client has after they've listened to you and seeing that, like, you know what, I can do this. I've had a couple falls, but I am getting back up and now I'm doing stairs again. And seeing that confidence and that light just go back into their eyes, like, I think that, like you're saying, is like, no wonder that's your favorite moment or a pivotal moment, because they did everything you said and you helped them get to that point. And then that light bulb went off that, hey, Alyssa, help me do this. Like, that's so rewarding as a coach or a mentor of anything.
That's what I imagine. I mean, it's like, I imagined them almost like coming back alive. I mean, I don't mean that to be like a pun or anything, but like they almost come back to life and they're happy. You see it like Jesse said, like having the light come back in their eyeballs.
I love those stories. Like, I truly do. And like for me, as a real estate agent, like I have a team of agents here in Nashville and in Utah. And for me, like teaching them and helping them to like get to that next step, it's like, will you please just try this? And once they do and they go, oh my gosh, it worked, it's like, thank you. Like, I've been trying forever lately just to have them send a video greeting via text message. Just says, hey, it's, you know, in my case, it's Jesse. Hope you're doing well. Let me know if I can help you out with anything. Just a video was hard enough. So, you know, getting people physically motivated is got to be even more of a challenge sometimes. So, but I love it. So we, and for those that are tuning in here, we do have a lot of work going on in our studio today. So if you hear something that just sounds like a monster in the background, you know that we're getting some work done here. But I do want to jump over to our infamous how to and two question. And we decided with this episode, we're going to do a how to and two times two, which is kind of a tongue twister for everyone. But
for the day.
Yeah,
so it's a good thing you brought that up.
That's all right. But we're going to jump in. Alyssa, in 2 minutes for our theme here, can you explain to those that, can you just give us a brief breakdown of how to understand and recognize osteoarthritis?
Yes. So essentially, like I had mentioned before, that osteoarthritis triggers a chemical process to start in your joint. So it's not necessarily from running too much when you are younger. It starts to trigger this chemical process. Now, that's whether you're eating poor foods or you have it in your genetics. There's all sorts of things that play into it, but you start this process. And so then you start collecting those inflammatory cells and you start losing the efficiency of your anti-inflammatory cells. And so what we want to do, so it's not that wear and tear, it's not stopping all exercise, that is not the thing we need to do. As far as what to recognize, I mean, looking for joint pain that's worse in the morning because you're sedentary for a long period of time, or that comes when you sit or stand for a long period of time, that you start to get stiffness. And it, can be pain, discomfort. It's not following an injury. So if you fell or something like that, that pain might not be osteoarthritis. It's kind of a chronic thing that starts with low pain levels and kind of starts to increase. But we just have to change our thinking. And that's one of the reasons, being a physical therapist, that you don't need to see a doctor first before you come see me. That helps with that, because when you go get x-rays and when you go and get imaging and you're told that your joint is deteriorating, I mean, that's very psychologically stressful.
Right.
And so if you come see me first, we can kind of rule out some of those things. And a lot of the times, if you do have osteoarthritis, you don't need an image to tell you that. It's just going to psychologically wear on you and make things worse. So I try to catch people early, and then early intervention is one of the best ways to manage it. I don't know if that was 2 minutes.
No, I love it. The how to and two, right? Like that's perfect. I mean, I would say 2 minutes, 5 minutes. People that are watching this are definitely interested in what you have to say. So obviously they are going to come to you first, like you mentioned that. So with that, we're going to jump into our bonus how to in 2 today, but how in 2 minutes do you help them move better to keep that adventure alive?
Yes. So one of my biggest things we start with first is finding exercises that don't hurt. There are thousands and thousands and thousands of exercises out there, so you don't have to just use the same program your friend did, or if something worked for someone and it didn't work for you, then people get frustrated and then they just stop exercising. So essentially, I try to collect a bunch of exercises that don't hurt you and that keep you moving in the right directions. Because a lot of times, as we get older, we start walking more for exercise. We start maybe riding bikes and those sorts of things. We spend a lot of time forward and backward. And we don't spend a lot of time going side to side. That comes with like sports and doing higher level things. But we have muscles that control those movements. And so as we kind of start to make our movements add a little less variety to our movements, some of those muscles tend to get weaker. Like walking, you work the same exercise or same muscles over and over again. And so the next thing when creating those exercises, we create variety. So we add variety, sidestepping, those sorts of things to really kind of get your body moving in different ways. And so I always try to tell people, like, if they like walking, if they like running, if they like, swimming, whatever it may be, that we can still do that, absolutely. But we have to add just a little bit of variety into that as well, so you can kind of become more well-rounded and be able to support your joints.
I love that. I know for me, when I had a fitness trainer, like the tailored workouts so that it didn't hurt or made me feel uncomfortable, if like you had a pain in your shoulder or something like that for the day, the tailored exercises definitely helped. And of course, anytime you hire a coach in any aspect of your life, whether it's business, fitness, just in general, better life coach, you start seeing results as long as you listen to the coach.
And as long as you put in the work.
And put in the work,
effort on
right.
your part too. And that's another thing, is just consistency and effort is going to get you there. But just kind of finding those exercises and then adding some variety.
Yeah.
And also just taking into account what you like doing. If you like walking, go ahead and keep doing that. We just want to add a little bit more to that.
Yeah, maybe push yourself a little bit more and step up on it.
What do they call it,
do a
grapevine?
step.
Switch your feet back and forth.
There you go.
Karaoke.
Yeah, karaoke, yes, that's what I was.
I hit at the gym the other day. I did a ladder for the first time in 10
Yep.
years, and I was just like, have mercy on my legs.
Were you
Like,
embarrassed
I
that you
was,
threw up after?
I was more embarrassed that it took me 10 minutes to get across the ladder.
Yes.
Well, awesome. Well, Alyssa, thank you so much for jumping on today.
Absolutely.
Like I said, this is always an interesting subject because people need that motivation, and people don't recognize these types of things. I mean, we hear all the time, like, check yourself, make sure you go to a doctor frequently, and people don't do it because we just think, I'm immortal, I can do this. And so, especially with arthritis, something that just kind of pops up really
Right.
quickly, and you just wake up one day going, oh, why am I so sore?
Well, I'm
Or
kind of
we
ones.
let pain get so severe, and then you go ask for
Oh,
help.
yeah.
Right, that's
And
usually how I am. But like, what kind of advice would you give, even for like I said, I'm 34. I can't remember how old you are, Jesse.
30.
30.
Yep.
Ugh, young buck. And I like what you probably see common, like either common injuries or things that people kind of just let go.
Yep.
What advice would you give for us that would be like, okay, if you do this, then this will kind of help as you do age? Is there
Yes.
anything specific?
So, I mean, the classical, it depends.
Sure, like it's a
But,
loaded question, right? Yeah.
But a lot of times, with knee weakness and things like that, one of the things is variety. So you don't want to pigeonhole yourself into, one activity. You want to kind of keep that variety open, which is why, sometimes CrossFit and that sort of stuff kind of gain traction, is because it's a lot of different movements.
Sure.
But another one is just your hips are kind of the driver of your back and your legs. And so if you can keep your hips strong, and there are obviously exercises and things that you can do that, but if you can keep your hips strong, then it helps with your knees, it helps with your back, it kind of helps with everything. Lower body. But I mean, a lot of injuries that I see and a lot of pains and things tend to come from the hips first from some aspect. And so kind of being aware of that to kind of see, you know, how you can keep your joints healthy. I think hip strength would probably be up there.
So what you're saying is go back to squats. Just natural body
Squats,
and
lunges,
Ugh.
you know, all of those sorts of things.
yeah.
Yes.
I don't know about anyone else's room,
Deadlifts.
but the squats and lunges are the 2 worst exercises of all time.
With knee pain, that's what you should be doing.
That's probably why I avoid them. But that's awesome. Well, Alyssa, we really appreciate it. Where can people find you? Like social media, it looks like you have, what is it, keeptheadventurealive.com is your
Yes,
webpage.
so www.keeptheadventurealive.com is my website. I have a free Facebook community. It's called Keep the Adventure Alive Community.
Cool.
So you can join that. And then I have a YouTube channel that's Alyssa Adventure Alive. So you can just do youtube.com/Alyssa Adventure Alive. I have tons and tons and tons of at-home workouts for people to do, especially through all of this craziness.
Absolutely.
People are working out at home. So lots of balance, lots of strength, lots of cardio for people targeted 55 and up.
I love it, and I love that you've got all these platforms to share this information on. I think that that's super important too, because
Yes.
everyone, you know, has a different platform they go and get their information from.
Sure.
So
I'm all over the place.
that's fantastic. So Alyssa, thank you so much for jumping on today and for that just plethora of knowledge you shared about the osteoarthritis. I think that that is super important once again to make aware and know the common signs, and more importantly, take initiative to help. You know, the preventative maintenance.
Don't wait till it gets so bad that
Don't.
you have to do something about it.
Yeah, or just give up and lay on the couch.
Yeah,
right?
exactly.
But, awesome. Well, we appreciate it. And, you know, hopefully, as always, we tell everyone that comes on, maybe in a year, we'd love to have you come back on.
Absolutely.
Take a look and see how much your business has grown and what new things you're bringing to the market. We absolutely love that. But thank you so much for joining our show today.
Thank you.
You're welcome. Thank you so much.
Awesome.